call the Health and Human Services Committee of the Wayne County Commission to order. Madam Clerk, if you're ready to do a roll call, please.
Commissioner Marecki.
Here.
Commissioner Dobb.
Here.
Commissioner Anderson.
Here.
Commissioner Baker McCormick.
Here.
Chair Colleen.
Yes, here.
You have a quorum present.
Thank you. Next item, Madam Clerk.
B, approval of the September 22nd, 2020 meeting minutes.
Move approval.
Support.
Thank you, Commissioner Anderson and Commissioner Marecki. Thank you. Thank you. Any
Baker
additions?
McCormick. Baker McCormick supported.
All right. All right. Sorry about that, Commissioner.
That's okay.
Any additions, corrections, changes to the minutes? Hearing none, we have a proper motion. All in favor of the motion, please say aye.
Aye.
Aye. Opposed, please say nay. Okay. Minutes approved, Madam Clerk.
C, old business. There is none.
Okay. Before we go to no new business, Madam Clerk, we do have, and I hope all commissioners have, we got our regular agenda, then we got an addenda, and we just got a second addenda sent to us. So there's, in total, 3 separate communications you got. On the original agenda, we have our 5 care maintenance organizations, our 5 CMOs, and their contracts for the new fiscal year. We can discuss them, but it would be certainly okay to have one motion for all 5. On the first addenda are our youth assistance programs. We will go through them, but it would also be acceptable to have one motion. I think it's 11 youth, youth what? We have 11 of those. We can handle them in one motion as well. And then we have some individual items. So I think that's, and it will come up on the agenda here in all of this as we're trying to get things through. On 3 of these contracts, there's 3 contracts have one little flaw in it where they have to get the right information. A mistake was made in the paperwork. Nothing to kill it. But when we discuss those 3 that still need an additional piece of paperwork, when we pass them, if it's the pleasure of the committee to move them forward to full board, we will do that with the provision on those 3 that the necessary paperwork show up by the Thursday meeting. So we'll get to all of that as we go. And let me go to the clerk. Madam Clerk, what's first under new business?
Item D1 under new business. Requesting commission approval of contract modification 30 to a contract with 3 one-year options to renew with Black Family Development.
Okay, and that is the same for our other CMOs as well, the other 4. It's the new contract. Commission staff, and yes.
Yes,
Yeah.
this is Julian Rainwater. One of those items, as you said, as you just mentioned, one of those items at Star Vista is contingent.
And why is Star Vista in that category, Mr. Rainwater?
There was a missing appendix, Appendix C.
Okay.
So once we get that, we're good to go.
Okay.
No, Commissioner, no, that's not correct.
Oh.
So for
Ms.
Star
Carr?
Vista, yes, for Star Vista, they have to fix the fiscal year under page 3, number 4, the financial risk, which Nellie is aware of, under their Appendix C9.
Okay.
So they need to fix the fiscal year so it states fiscal year 20, not fiscal year 19.
That's the only change to that, Ms. Carr?
For this one, yes.
Okay. Mary Carr, what's your title, please, for the record?
Senior Fiscal Analyst.
Thank you very much. And so, commissioners, when we get to the Star Vista or when we make a motion, it would include receiving the change in the fiscal year. So I guess I'll go to administration. These are our 5 CMOs that deliver an awful lot of youth services for our juvenile justice program. Who is going to introduce this from administration, please? As people scramble for their mute buttons.
Shanetta Coleman, I know is there.
Well, we'll get
Am
there.
I unmuted?
I heard you.
He's muted again.
Uh-oh. You know what? I think it's because you see me in 2 places. One should say Dr. C's iPhone,
I see.
and then the other one says Shanetta Coleman. My work laptop doesn't have a camera or a microphone, so I use my personal phone to get through.
Well, Dr. Coleman, we can repeat an old joke here. How can you be 2 places at once when you're really nowhere, when you're really nowhere at all? Dr. Coleman, you would like to introduce these, name and title for the record?
Shanetta Coleman, Juvenile Justice Director. These are, as you mentioned, Commissioner Chair, that these are the 5 care management organizations that provide case management and all other services, and ensuring that mental health services, substance services, counseling, therapeutic services are available for the adjudicated youth who are part of Wayne County's juvenile justice system of care. These care management organizations are situated, excuse me, throughout Wayne County, each of them serving a particular catchment area by zip code that has been assigned to them. And so we are asking to extend their contract by 1 year. We will be putting forth an RFP for these services at the beginning of the calendar year. But this will allow us time to incorporate some of the requirements for the age 17-year-old legislation that was passed, as well as some of the changes that are currently underway with Michigan Department of Health and Human Services for the qualified residential treatment programs, by which the care management organizations will be required to ensure adherence to for any youth who is placed in a residential facility under their care. So I was just on a call with the state right before this call, and they're still working out the details to that. So we wanted some time so that we can have everything that we need at the point that we put these RFPs out for response.
Thank you for that, Dr. Coleman. Commissioners, get ready to ask questions. I'm going to start with, in a second here, with Commissioner Marecki. But Dr. Coleman, when was the last time we RFP'd our CMO contracts?
I want to say that it's been at least 7-8 years.
Yeah, okay. So probably 2 cycles worth of contracts.
Yes, because they had, there were 5-year contracts, I believe, initially, with the renewal options on them. So we are at the
It was
point
5-year, correct, yeah.
Yes.
Okay, and for you, Dr. Coleman, but also for our staff, when you come back after the RFPs, please update us on what kind of changes the state is making and what kind of requirements will have to go into those new contracts a year from now. So please be prepared when that time comes to give us an update on how the state is changing the requirements here and what we have to do to meet them.
Absolutely.
Thank you. We will go to questions by commissioners. We will start with Commissioner Marecki. If you're ready, Commissioner, do you have any questions?
Yeah, thank you. Thank you, Mr. Chair. So the pay, what's going on with the money is just going to go like for the next year. Are there any changes like with Medicaid or anything like that with these CMOs, or is that coming with this with the 17-year-old issue gets into place. I'm probably not making myself clear. Is there anything coming down the road that's going to change payments for the kids in these CMOs that you anticipate?
Not that I can think of that is coming in terms of from the state. In terms of how the payments are going to occur for fiscal year moving forward in the RFP, that is still up for discussion. By that, I mean that there's been a lot of discussion around, we currently, as you all are aware, use a capitated rate model. And we make these quarterly adjustments really based on the days of care and the number of youth who are in the program, depending on where they are with these assigned care management organizations. As we start moving forward, we're not sure as of right now if the capitated model at 100% is going to be the model that we will continue to use for a number of reasons. We have been investigating other potential models where it could be partially capitation, and then some of it could be based on specific services. There are a couple of different things that are occurring across the country, so we are going to be looking at what is in the best interest of our youth. And then when we take into consideration what's happening with the requirements of the state in terms of what the qualified residential treatment programs, we still do not know what that cost structure is going to look like. The state has been very clear, however, that they expect that there will be an increase in what it costs to do that, because you have to have medical staff on call 24/7, and there's so many unknowns right now, Commissioner, that it's hard for me to say today exactly what that cost structure is going to look like.
Okay, and that's part, I mean, I remember, I thought a couple of years ago, you guys were going to put it out for bid, but is it because of these type of unknowns, that's why we extended it, like year by year, the last couple of years?
Well, last year, definitely,
Okay.
because at the time, a couple of years ago, there was a lot of discussion around the raise the age legislation, and it had not been passed, but we knew that it was in discussion, and the likelihood of it going through was more likely than not. At that time, we also didn't know what that was going to look like and how that may or may not impact how we currently do business. We currently serve 17-year-olds, obviously, if they come into the program, but generally if a kid is, or a young person is 17 and a week or 17 and older, oftentimes they go to the adult system. So there's been a lot of discussion around how do you put services in place to address the need of 17-year-olds as juveniles, and what is that cost structure going to truly look like? What we know right now is that nobody knows the answer to that. And so according to what the state is sharing with us, that they're going to also take some time to really, maybe that first year, evaluate the actual cost, and then by the second year, we would know more about what that true cost really is and how that may or may not be factored into the child care fund, if it's going to be completely separate in terms of the funding stream, or if they're going to put it all together. It's just a lot of discussions that are still going on right now, and I don't want to speculate. So we thought that by this time we would know more, but I think it's more to building this thing than just kind of making a decision in a vacuum. And so we want to be considerate of that. And that was one of the reasons why we postponed doing the RFP, hoping that if there was something that would give us some guidance in doing that, we would have enough information at that time.
Yeah, okay, thank you very much. Sounds very complicated. Thanks.
You're welcome.
Thanks, Mr. Chair.
Thank you, Commissioner. Yeah, anything to do with money and Medicaid payments and that sort of thing right now is all up for grabs in Lansing and in DC. Commissioner Dobb, you're next in line. Do you have questions, Commissioner?
Yes, thank you, Mr. Chair. How has COVID-19 affected these services, and are these companies properly equipped to go remote? What precautions are taken for services that cannot be virtually provided?
So one of the great things about the care management organizations that we currently have is that they're very resourceful and that they have been able to make adjustments where necessary in order to ensure services continue. That is also the beauty of having care management organizations who have a lot more flexibility than a lot of agencies would have if they were delivering the services. So they've been able to make it happen. What is also important to know in terms of how we've been managing and ensuring service delivery under COVID is that we have been adhering to the governor's orders as well as Wayne County's health officers' orders in terms of the stay at home and or, limited or no face-to-face contact. And in doing that, we've developed protocols and policies that have then been transferred onto our care management organizations. What we have been able to do, Commissioner Dobbs, is we've been very creative. We have been able to use technology, whether it is FaceTiming, Zooming, all of the virtual platforms that the care management organizations have had access to be able to use. They've been doing that. And some of them for in instances where young people don't have the technology so that they can be virtually communicating with their case managers, they have been as creative as doing what I'm going to call a drive-by, if you will. I'm going to come by your house. I want you to open the door so I can see you. If I need to communicate with you through the door, through the window. So they have done everything possible to ensure compliance as much as possible, increasing the frequency of phone contacts as well. And so I've not had any indication from the care management organizations that they have been unable to deliver that service based on what's required of them in terms of making those weekly contacts. So we're in compliance with what the governor's orders are as well as the county's orders.
Okay, wonderful. Thank you very much. Thank you, Mr. Chair.
Thank you, Commissioner. And before we go to Commissioner Anderson, I'm going to follow up on that real quick, Dr. Coleman. Will it be next month that we will see the fourth quarter budget adjustments for the CMOs based on encounter data for the fourth quarter?
Yes, you generally would see that sometimes around late October. Okay.
And I think for Commissioner Dobbs' purposes, I think when we see that encounter data, we will see whether there's been more contacts, fewer contacts, to give a sense on how services may have changed during COVID. So I think when we see that encounter data for the last quarter of the year, which would be July, August, September, we'll have some idea there of how services have or have not changed based on the encounter data. Commissioner Anderson, are you ready for questions?
Yes, I think playing off just what you had mentioned, one of my questions is trying to for the committee members in this county. I wondered about the efficacy of the different groups that we're contracting with as far as number of individuals they serve. And maybe that's what you were speaking of, and trying to, is there some type of a rating that's applied that says, yes, you're doing a good job? I mean, I know I saw something in one of I think it was the agenda, the main agenda for the main part of the meeting, something about the rating as far as how many come back through the system, how many complete the process. Did you say we'll be getting some type of report like that later on this year?
Yes, you will. You'll be getting, I think what you're making reference to is we actually look at outcome data. Mm-hmm. And by outcomes, we are looking at how many kids matriculate through the system, how many of them has successfully completed their program, how many of them may have been escalated from one level of care to another level or de-escalated, and just overall, how well are we doing? You will receive that. you should receive that really, really soon, actually. But so we have the outcome data for how well they did the year before. And then by November, end of November, 1st of December, we will begin to gather that information for fiscal year ending 20. So, you know, we have a very sophisticated technological database that we use to capture what's happening with our young people, where they are at any given time, how well they're doing, if there's incidents that occur relating to them, and we take that information from the database. So this is not necessarily self-reported information from the care management organizations. We can gather that ourselves through our JAS system, which you may have heard us talk about before. But in addition to that, in terms of how well things are progressing, we have what I will call a 3-tiered approach to how we look at quality assurance, and how well not only are the youth progressing, but how well the care management organizations have been progressing.
Okay, and the CMOs, I know are a pass-through organization, correct?
No, they're not a pass-through. The CMO organizations, you mean, are we passing through to them, or are they passing through to someone else?
They passing through to someone else.
No, the care management organizations are all not-for-profit organizations. They are doing direct care. They are contracted or subcontracted with other providers. For example, we talked a little bit about the levels of care, where we have young folks who are at a community level, where the CMOs themselves are providing that care management or case management services, or mental health services, or substance use services. However, they are not residential providers. And so when young folks are under their care and they require what we refer often to as probation level 2, which is an out-of-home placement, that care management organization then subcontracts with a residential provider to ensure care for that young person. But they are also simultaneously ensuring that services are being delivered in accordance with the treatment plans that CMO has developed for them.
Okay, all right. Okay, that's all I have right now. Thank you.
You're welcome.
Thank you, Commissioner. Vice Chair Baker McCormick, you're next.
Thank you, Mr. Chair. The CMOs, we had talked about some time ago having them attend our meeting. Is that something that we can still arrange?
Yeah, it is, Commissioner. Yeah, Commissioner, send me an email on that to remind me, because it would be good, especially going into an RFP year. And I'm sure the CMOs would be delighted to come and talk to this committee for a little bit about what they do. So send me an email to remind me, Commissioner, and we'll start lining people up.
Yeah, I think that's important to do, because we really haven't spoke with them directly about some of their programs, and would be good to just kind of go over with them.
And at 50 to 90 million a pop on these things, it's not like we're just spending a couple of nickels with them.
Exactly. Now, has there been an increase in, or has there been any cases of COVID that you know of within the ranks or of the young people that the CMOs work with?
We have had just recently a couple of youth who were placed in residential care test positive. They were asymptomatic, but they did test positive and have been quarantined as a result of that. But this is just really recently having had occurred at one of the residential facilities of a young person assigned to a CMO.
Okay, and so when they're quarantined, is that at home, or you're saying is it within the residential? Is it a residential program, or you're referring to just being at home?
No, I'm referring to residential care. So the care management organizations have young people who are both community level and those who are out of home placement, which is the residential facilities. I'm referring to the residential facility care. So the CMOs are notified if a young person tests positive, and the care management, the residential facility who has that young person under their care has quarantined that youth or those few youth, and to ensure that there's no spread. But I have not gotten any reports from any of the care management organizations that there has been anyone hospitalized or severely taken ill as a result of being COVID positive.
Okay, and what does the quarantine look like? Because if they're in a residential program, are they just kind of locked in their room, or do you know what that looks like?
I don't know for each of the for each of the residential facilities if they all do the same thing. I can tell you from what I know we would do. We have at JDF, if it's similar to the way we would operate, we would have we would have a unit, or we use the term pod, where we will quarantine them away from the general population as not to spread anything. So more than likely, they would have been quarantined in a unit. I don't believe by licensing that they're required to lock anyone in their rooms for in excess of a certain number of hours. So you can't lock someone in for 24 hours, just to give you an example. So I would think that they've been quarantined in a unit, probably with other folks who have tested positive, so that they can all ensure that that doesn't spread throughout the facility.
Okay, and as far as sanitizing, and so that there's really no, I guess, procedure or structured procedure in place for this situation.
I'm sure that it is, Commissioner. I just don't know it for every facility, because every facility have their own operating procedures or standard operating procedures. So I don't want to say that they're all the same.
Okay. And then the last question is, due to our schools being out, well, a lot of them having virtual classes, have you seen a rise in cases? And is there a way that we are communicating with parents or schools to let them know that we do have resources and we can assist or help in situations? Because I think young people are just as stressed as adults, and maybe even more so because they don't have the routines that they used to have, and they're kind of isolated in their homes. Is there something that the CMOs or the county can do to help to reach out to these young people and to parents and schools, and just letting them know that we have resources?
I'm going to try, and I think I heard 3 different questions, so I want to answer the first one first. As it relates to a rise in cases with young people, I think that's a question that's probably best answered by our public health officer. So because I don't keep that kind of data in terms of just kids overall or youth overall, I only keep up with those who are adjudicated and assigned to our organization, our network. And so to piggyback on that, the care management organizations have done an awesome job working with not only the youth who's assigned to them, but working with those families. And they always ensure that they're aware of services that will be available to them. And they have done an awesome job of advocating on behalf of not only the youth, but the families of those kids who are involved in the system.
Thank you.
You're welcome.
Hi, yeah, this is Carol Osterberry. I am on, and we have not had
Title,
any.
please.
I'm sorry. Oh, sorry. Carol Osterberry, Health Officer.
Thank you.
And just to, add more comments to that question, yeah, we have not had any COVID-19 cases, outbreaks in the in those facilities. And we have been tracking.
Great, thank you.
Commissioner Baker McCormick, you still have the floor. Anything else?
I am all set. Thank you.
Thank you. Dr. Coleman, do you have the data for fiscal year 19 that we were talking about previous? That the fiscal year 20 data would be available soon. Do you have fiscal year 19 data?
I do, Commissioner, and it hasn't come to you, so that's what I was sharing. What you should be getting in very short order.
And that would be for which year?
That's for 19.
Okay. I thought you were referring to fiscal year 20. So it's a year behind, right?
It is behind. So fiscal year 19 data is done in the annual report. It's completed. Fiscal year 20 data won't come in. We don't get that information until year end. So you will get that data in 21.
Okay. So you have 18.
Yes, we have 18 data as well.
Would you forward both the 18 along with the 19 data when that becomes available?
Yes.
Because I do think it is so important, the work that's being done here. About how many youth are among our 5 CMOs? Doesn't have to be an exact number, but how many kids are we talking about?
Around 700.
Yeah. And by the way, I want to thank Commissioner Baker McCormick for remembering us young people and how we're affected during this time. So it is important what we're doing with all these youth, and I think especially with RFPs going out, and then hopefully about 9 months from now, we're going to be looking at proposed contracts for the following year. With new contracts coming, to be able to have more of a discussion about how we evaluate these organizations. I don't believe we're able to track these young people once they leave our system, but we can talk about that later. And when we look at data for how well we're serving these young people, and their recidivism rates going out 5-10 years or something. We'll talk about all that later, but if you could send the 18 along with the 19 when you have it, and I think that'll lay the groundwork for a good, healthy discussion when we come back in a few months with proposed contracts for the 5 CMOs. So that
Absolutely.
would be the pleasure of the committee. And I'll remind you that on item number 5, Star Vista, we would need a contingency for that item so that they get the paperwork that changes it from fiscal year 19 to fiscal year 20 on whatever piece of paperwork they sent us by accident or whatever. So what's the pleasure of the committee here?
Mr. Chair, I'll move those items.
Those 5 CMOs, Mr. Commissioner Anderson?
Yes. With those,
including the provision on the Star Vista contract that we received that? Okay.
Were there
Is
any
there
other
some-
corrections on any of those other items?
No, there is not.
Okay.
We will have one of the app program and a similar kind of thing with the SEMHA contract later on. Just some oopsies in the paperwork, nothing really substantial. But for the CMOs, no, just this one.
Okay.
Is there support for the commissioner's motion?
I'll support Daub.
Thank you, Commissioner. So it's on the floor to be voted on. Is there any other questions any commissioners would like to ask before we go to a vote?
Mr. Chair, I was going to mention that it appears as though we've lost a number of people off the meeting.
I haven't checked in that in a while. Is that? Yeah, I don't know. I still see I
You still
see
do?
42 that are on the
Okay.
list. Okay. Hearing no more questions on these, we have a motion before us to approve items 1 through 5, the so-called CMO contracts, with the provision that in number 5, we get the piece of paperwork that changes it from fiscal year 19 to 20. All in favor of that motion, please say aye.
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 Aye. Opposed, please say nay. Any abstentions? All right, unanimous on that motion. Thank you very much. Madam Clerk, where are we going to next?
We are on item 6 on the addenda. Requesting
Okay.
commission approval of a 3-year contract with 2 one-year options to renew with the Union Inc.
Thank you. And so item 6 through item 16, which is the first item on the second addenda, we have youth assistance programs. Mr. Rainwater on staff, one of these has a paperwork issue, sir?
Yes, sir. That one is Spectrum
Name and title,
Child and Family-
please, sir. Name and title, please.
I'm sorry. Julian Rainwater, analyst, the legislative research. That one is Spectrum Child and Family Services, and that one is contingent on receiving a corrected price sheet.
And what
Mary,
does-
would you have anything to add? Oh, sorry.
No, it's fine. What does a price sheet mean?
Through the chair.
This.
Go ahead,
Go ahead,
Julian.
Mary.
Ms. Carr?
Okay, so for all of these, there is always a price sheet that gives down a payment calculation, what each allowable maximum allowable amount is per each youth. So for Spectrum, they had given us the wrong amount. They had stated it was $35.52, and in fact, it's $579.36 per maximum allowable cost per youth. So they have to
Ooh.
fix those.
Yeah, an order of magnitude. Has Spectrum Child and Family Services acknowledged this in your conversations?
My conversations were only with the Department of Health, Human Veteran Services, so that I don't know. Nellie, if she's on, might be able to answer. Shanetta?
I
Yeah.
am. Nellie Lee is on. I'm sorry.
Yes, ma'am. Name and title for the record.
Nellie Lee, HVS, Policy and Compliance Director. We did speak to the Juvenile and Youth Services Division. Dr. Coleman and Ms. Cecily Holglid spoke with the vendor, and they have acknowledged the error in this, and they actually have corrected it, and we will be processing it through very shortly after this meeting.
Thank you very much. Thank you, Ms.
You're
Lee.
welcome.
Okay, I guess we'll go back to Dr. Coleman then. I believe this is 11 youth assistance folks that we contract with to deliver these services. So would you like to kind of talk about them all as one, if you will, what they're providing out there, Dr. Coleman?
Absolutely. Shanetta Coleman, Division Director. So the Youth Assistance Program that you have before you is what we like to refer to as our front-end services, and in many instances, prevention services. These are services that are approved by the court for young people at risk of adjudication, and in some cases who have been adjudicated but may have stepped down from a probation level to more supportive services beyond their probation. So it is community-based programming that could range from anything from counseling to conflict resolution, tutorial service, supportive services, and the like. And what's unique about these particular youth assistance program providers is that they too are uniquely situated throughout Wayne County in communities where young folks would be able to access them easily and be successful in their treatment goals, to ensure that they are not further matriculated into the juvenile justice system. And so it is not probation. And these providers also support our diversion services as well, or types of activities for young folks who have been diverted. Again, they're prevention services, and they are services that generally range in duration for up to 90 days. And they differ based on the provider. But that's what happens in a nutshell.
All righty. Thank you very much, Dr. Coleman. Do we have data? You mentioned a lot that these are diversion programs. We also have the programs to identify youth that are at risk, even though they have not been in the system yet, but a circuit court judge could order them into our diversion programs. What kind of numbers do we have on recidivism with the young people that have gone through our program?
These programs tend to be extremely successful. You're talking 85% to 88% success rate with the youth assistance programs, and our young folks who have been receiving or placed in them as a result of diversion, they run around 70 to 74% success. But these, and by the diversion, I just want to be clear, very, very specific when they come into care as a alternative to being adjudicated. If they do not do what's required of them and information is shared back with the prosecutor's office, where they may have violated the agreement, then they could, they run the risk of being formally adjudicated. So you might see a lower success rate there. But we have a lot of young folks who participate in these programs on an annual basis, but overall high 80s success rate for the outcomes for these. So we're excited. We want kids to be in these programs as opposed to being on a probation level status.
Yeah, the alternative's not so good. All right, let's get questions from commissioners. We'll go around the table, and Commissioner Marecki, you're first up.
I'm all set. Thank you, Mr. Chair.
Thank you, Commissioner. Commissioner Dobb, questions, please.
No questions for me either. Thank you.
All righty, thank you, Commissioner. Commissioner Anderson?
I'm all set. I do have one quick one. Janetta, I was just wondering if you could tell me, Shanetta, the very first one, number 6, YUNION, Union. I don't know if that's how it's pronounced.
Yes.
But I just wondered, I have not seen that name before of that organization. Has it been a contractor or all along?
They have, Commissioner. They have always been a part of our, YAP program services for some time.
Okay. All right. Yeah, I'm good, Mr. Chair.
Thank you, Commissioner. Vice Chair Baker McCormick, questions?
Thank you, Mr. Chair. I think I asked the question when we were talking about the CMOs, about the outreach in an effort to make sure that parents and schools know that we have these programs. And I'm not sure that there was a clear answer to that. Again, due to COVID and parents, students being at home more, I'm just wondering if we need to change the way we reach our constituents.
Well, let me try and see if I can answer that question a little bit greater clarity. As it relates to how we engage schools in terms of what's available, we have done that pre-COVID, clearly working with the schools, and oftentimes we get referrals from schools. It becomes a little tricky though when it comes to adjudicated youth or youth who are quote unquote court involved, because they have to be deemed at risk for removal from home. And so when we talk about the court signing off for their participation in the program, obviously if it's an adjudication, then those kids have been found to be responsible in some kind of way for whatever action that they have taken to bring them to the attention of the court. As it relates to the youth assistance programs, they've been ticketed or have come to the attention of the court, and then that's how we get involved. In the court then has also approved their participation in these type of programs. But we do have relationships with the schools, because they know that we sometimes even go to the schools. The care management organizations do the same. They will go into the school, but they're not going to the school necessarily to recruit youth for services that's rendered. They're going in a support, to support the youth that they're there to see and to offer up the school to be able to be in connection with them as they support the student. And the same will be true for the youth assistance programs. And many of the CMOs even have presence physically in schools. And I think one or two might even have an office nearby or in the schools. And so they are doing that. But when COVID occurred, Commissioner, initially it was a stay in place order. And so we had not been in discussion with the school about what happens post-COVID or during COVID. We've not done that in terms of outreach. So I want to be clear about that. But we have worked with, I know even Ms. Allen has worked with Wayne Risa on a number of things as it relates to COVID, and as well as we've worked with them and some of the schools that as it relates to COVID in our juvenile detention facilities, but not necessarily in terms of saying, hey, this is what we have and this is what we're offering during COVID time for young people while they're at home. And for a couple of good reasons. One is because we wanted young folks to stay at home, and we've had minimal physical contact with them. And we have began to use these virtual platforms to communicate and keep them supported in whatever way that we need to keep them supported. So so I would answer your question that no, we've not put forth any additional effort to say this is what we have done and this is what we are doing for kids who might be affected by COVID, just because they're, getting anxious like adults get anxious from being in the house all the time. So I hope that better answers your question. But no.
Yes, it does. And I really appreciate the work that you are doing. I'm concerned about the increase and uptick in violence. And, in my neighborhood, I see kids kind of roaming around when they should be in school, of course, but they're not. And I'm just wondering how this whole, stay at home and COVID is really impacting our young people. And we will probably see in the near future that they're not handling it very well. Mm-hmm. And those that are at home with maybe their grandmother and don't really have any real guidance. I'm just wanting to know that somehow we're still reaching them. And so that's my concern.
Yeah, we are still working with the courts, by the way, for young people who are not officially or legally in the system. So we don't have any of our first contact programs for you today, but those would be young folks who may not be juvenile justice involved, who are at risk of being involved, that we would want the coordination and we work with the schools very well on these types of young people. And so we do have some referrals to the court for first contact, but as you know, the court was operating on a very limited basis as well. So any youth involved in programming that we have to provide. We do have to ensure that the court is aware of their involvement, and there are, requirements that have to be met under, our child care fund in order for them to participate in these programs. And that would be that they are at risk of out-of-home placement or at risk of being adjudicated because of maybe behavior or doing some of the things that you're talking about, not participating in school, hanging out with the wrong crowd, being mischievous. Those are things that would bring a kid, who is not already involved to the attention of the court of someone who may be a prime candidate for prevention services.
Right. And so if we have a situation where we think that a youth should be referred, then how would we do that? Or how would a parent?
In the absence of school right now, parents can actually call and want to engage. We do have a partner in this, and we use Assured Family Services. They are the assessment center who would then work with the parent and a provider in that particular zip code area for the youth to try and get the court to make a decision about if this kid meets the definition for being at risk of adjudication. So that's one way. And I'll be more than happy if you don't already have that Assured Family Services contact information to share that. But sometimes if you know of a particular agency that we're working with, if the kid lives in that community, then that provider can also contact Assured Family Services and say that they have a referral. So there's two different ways that we can go about doing this, but the ultimate decision is going to rest with the Third Circuit Court in terms of if this youth meets the requirements that are, that would make them eligible to participate in the program.
Great. So I would like that information. I probably have received it at some point, but didn't realize that was the actual agency to contact.
Sure.
Thank you.
You're welcome.
Thank you, Commissioner. Dr. Coleman, Assured Family Services used to be called the Juvenile Assessment Center.
Yeah, they changed their name a couple of years ago because they started as a juvenile assessment center and they have grown exponentially in terms of what they do. And so they became Assured Family. Yeah.
I just wanted to point out to my colleagues that the core of what Assured Family Services does is do an evaluation of all our youth, correct? And
that would be
so
correct.
Everywhere in our juvenile program, what we have for the young people as far as what services they need and all of that, that is all decided through the assessment that the Assured Family Services does. It used to be the Juvenile Assessment Center. Is that correct?
That is very good. Yes.
Yeah, pay attention every once in a while, Doc. Over in Circuit Court, I know the Chief Judge, Kenny, has been very much concerned with these kinds of services for young people and options for the court. And it strikes me maybe him, or who's the Chief Judge in the Juvenile Division now?
Judge Joseph.
Oh, he is?
Yeah.
Do you work a lot with Judge Joseph?
I do.
It might be appropriate a little down the line here, and staff take note, that we invite Judge Joseph over to talk about from the perspective of the court, what these programs are doing, and maybe entertain a discussion about what else they perhaps see as needed out there. I didn't realize Judge Joseph has been the head judge over there. Okay, but I think staff, make a note of that, and in a few months we'll get Judge Joseph over here to talk about all of these youth services from the perspective of the court. Thank you. Pleasure of the committee on items 6 through 16, the youth assistance programs, and the motion would include on item 16 that we're awaiting the correct pay sheet, I believe is what it was called. So what's the pleasure of the committee on the youth assistance program contracts?
Mr. Chair, I'll move for approval of those items.
I'll support.
All righty, including, we will hear at full board that we have received the appropriate $500, not $50. All right. Proper motion and been supported. Any other questions on youth assistance programs before we vote? Hearing none, all in favor of the motion, please say aye.
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 Aye. Opposed? Say nay. Any abstentions?
Mr. Chair, I'd like to abstain on number 10, please.
An abstention for Commissioner Marecki on 10. Thank you, Commissioner.
Thank you.
Okay, with that, we took the vote, right? You threw me off there,
You
Commissioner
might have
Marecki.
to take it again because Commissioner Marecki abstained after the vote, so we have to do it again.
Well, I don't think we have to do it again. Her vote was yes, except for the extension of on the one item.
Correct.
And it's a yes vote on everything else. So if we can just note her as an abstention on that one item, which is what again, Commissioner?
Number 10.
Number 10.
Okay.
Yep, that will do her.
Thank you.
All right, Madam Clerk, let's roll the agenda. I believe we're on the second addenda now.
Yes. Item 17, requesting commission approval of a grant award with the Senior Alliance.
All righty. And administration, these are the folks that handle our senior programs downriver, Meals on Wheels, and I guess we're not doing congregate meals right now, but who from administration is introducing item number 17, the Senior Alliance?
Joan Savrakis, Division Director, Wayne County Senior Services.
Happy COVID.
That's an interesting statement.
Well,
There's such a thing.
this is how I see you, in a little corner of a box on my screen about every 3 weeks. So welcome, good to see you.
Thank you, Commissioner. Yes, Wayne County Senior Services received a $25,000 grant from Meals on Wheels America through the Senior Alliance to assist in funding, and we applied it to the Halal Meal Program.
Okay. Remind us how that works again, Ms. Savakis. Just how the money is handled in between the county and the Senior Alliance.
Yes, the Wayne County applies for, we complete an RFP for the funding from the Senior Alliance to administer the congregate home delivered liquid and halal meal programs through the Department of Senior Services.
So the Senior Alliance pays us to deliver these services.
They reimburse us. Yes, they do.
Where do they get their funding from?
They get theirs from state and federal.
And it has to occur that way rather than the county getting the funding and hiring that. It has to work that way because of the senior agencies.
The
like
Senior
DAAA.
Alliance, yeah, the Senior Alliance is one of 16 area agencies throughout the state of Michigan,
That's what I
DAAA
was.
being the other one. And the dollars, the funding for the nutrition programs comes through the area agencies on aging.
Okay. And then they contract with us. And then we have the staff and whatnot to actually deliver the services.
I'm sorry, I was not able, the audio went kind of funny.
Well, that's what happens in politics. A lot of mumbling. We hope nobody notices. So
That's better.
since the funding goes to the area agencies, and that's probably all across the country, then they provide us the funding because we have the staff to actually deliver the services. Is that correct?
I do believe that there are some requirements that, because the nutrition program typically is one of the bigger programs conducted through the area agencies, the area agencies are required to contract the nutrition programs with another entity, as opposed
Doesn't have to be government.
Doesn't have to be government, no.
Gotcha. Okay. let's see what kind of questions commissioners have on this. Commissioner Marecki, bat and leadoff.
Yeah, I'm all set.
Thank you,
Thank you.
Commissioner. Commissioner Dobb.
No questions for me. Thank you.
Thank you. Commissioner Anderson, you're up.
I have nothing.
And batting cleanup, we have Vice Chair Commissioner Baker McCormick. Okay. Just checking real quick to see if we lost her. No. Commissioner Baker McCormick, do you have any questions on this item? Okay. Don't know what happened there, but she obviously wasn't waiting by her mute button to go, ooh, I got a question. What's the pleasure of the committee on this item?
I'll move approval.
Thank you, Commissioner Marecki.
Support
Oh.
Anderson.
Commissioner Dobbs' picture popped up first, so thank you, Commissioner Marecki. Commissioner Dobbs supports. So this is for item 17, for a grant award for our halal meal program. All in favor of the motion, please say aye.
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 Aye. Opposed, please say nay. Are there any abstentions on this item? All righty, passes unanimously. Next, Madam Clerk.
Item 18, requesting commission approval of a 5-year professional services contract with the Southeastern Michigan Health Association.
All righty, thank you. I'm going to go to staff here. Mr. Rainwater, slight issue with this. Would you please fill us in on it?
Yes, sir. This one is also funding related. So we'll have Mary pitch in on this one, but the funding source is incorrect. So we get that corrected. I'm assured it's saying we're good to go.
Oh, we are, as it stands here.
No, I'm sorry. When we get the funding source corrected,
Okay,
we'll be good to go. Yes, sir.
okay. And when you say the funding source, sir, what are you referring to?
Where the funding will be coming from for this agreement.
Is that Wayne County or is that SEMHA?
Actually, it's where the funds are deposited by the administration in this case. These are grant funds.
Okay. All right.
So any deeper than that, we're going to have to go to Mary.
I got you.
right.
Well, I will ask fiscal staff.
Yes, sir.
Yeah, Ms. Carr, could you fill us in on how big of an issue this is?
Through the chair, Mary Carr, Senior Fiscal Analyst for the Commission. It's not a big issue. So instead of having the funding number being 221 for county health, they inputted 211, which isn't part of the health department.
I got you.
So that's the only thing they need to change. It doesn't change any dollars or anything like that.
I got you. Okay. Thank you. You know, and I appreciate staff, everybody working remotely, and the big drive here to get everything in by the end of the fiscal year, which is essential, that we start the fiscal year with these contracts in place. And I know the same thing is going on with administrative staff in the executives department. So there should be no surprise. There's a couple of little boo-boos like this as we go through, but I know staffs both at the commission and in the executive branch are working very hard. So who from the executive's office is going to introduce this contract with the Southeast Michigan Health Association, otherwise known as SEMHA?
Hi, this is Carol Osterberry, the health officer. And yes, this is our 5-year contract with SEMHA. This was awarded through the full RFP process. And as Mary has said, these programs that go through the SEMHA contract, it is all grant funded programs. public health, and then we even have a few that are other programs, but all of the programs are through the Health, Human, and Veteran Services Department.
Okay. When you say funded, different programs that we do, how does that money work back and forth between SEMHA and the county?
Right. Every month, SEMHA then invoices the county. They present a monthly financial status report to the county. We compare it to make sure that there is sufficient money, because we have also every year we do separate SEMHA SEMHA budgets, and then we, pay that monthly financial status report back to SEMHA.
Okay, so SEMHA does our child lead poisoning, and we pay them to do it?
The employees that were part of that program, yes.
Yeah,
The
ferret that out a little bit more, please, Ms. Osterberry, because you said the key word here, employees. And that's really at the heart of the contract between the county and SEMHA. And certainly Wayne County is not the only one. Same thing goes on in Oakland County, same thing goes on in Macomb County. So what are we actually hiring them to do?
Right, and I'm sorry, you asked specifically about the child lead?
Yeah, I did.
Yes,
But
okay.
that was
yeah,
to get at the larger issue.
Sure. Those were the employees that went out and did the lead inspection, assessments on the homes, did the inspections, and then, for the lead-based paint abatement. But
So
the
those
staff
SEMHA
were in the
employees
homes
or-
doing those inspections. Yes.
I'm sorry, SEMHA employees, or are they Wayne County employees?
We have Wayne County employees, but we also had to, because it was just a limited time grant, then we hired in additional SEMHA employees.
I see. Same is true at the FQHC in Wayne?
The FQHC in Wayne, I do not directly manage that program.
I got
but
you. Yeah, right. That's out of your bailiwick. Yeah.
Well, this is Kamal Keparu, Finance Director
Yes,
for the
sir.
department. Yes, the FQHC has employees on this contract also.
Okay. I talked with commission staff before this. I don't know if it's Mr. Rainwater. Can somebody on commission staff just give us brief, and I mean brief. We've dealt with SEMHA for a while. This is a 5-year contract coming up. Can you tell us how long we have had this relationship, commission staff, between SEMHA and the county to provide these employees for these functions?
Yes, sir. And looking at the history with SEMHA, it goes back to at least 2007. Most of these contracts, there's several, somewhere in the neighborhood of 10, 12 contracts, have been for considerably less than this one. I suppose it has something to do with the 5-year period, because several of these agreements were modifications to an original agreement, so that's why they were less. But yeah, the other thing that I found interesting is how it was formed, or why it was formed. It was formed by several local communities, counties, Wayne, Washtenaw, Oakland, and so forth, and the city of Detroit. 8 of those entities all together to assist other municipalities or agencies or local governments to process and assist in public health grant-funded contracts. So they got together to make it easier to do what we do when it comes to those kinds of contracts. And they perform all kinds of services, from administrative services, fiduciary services, and supply employees.
Thank you, Mr. Rainwater. The key word there is grant-funded services.
Grant-funded services.
Yeah, and so I see like pool inspections
Or
are on here.
grant-funded.
I'm sorry?
I'm, I'm sorry. No, grant funded services, grant funded agreements, that sort of thing. So they assist with all that.
Correct. And for Mr. Rainwater, commission staff, or indeed
Yes.
administrative, this was, as you say, this was put together a number of years ago to help local governments provide health services. Is it fair to say that by local government essentially hiring SEMHA with the grants that we get, then we get the job done, but the city and the county don't have those people as employees on their system, and so we decrease our labor costs in the county by hiring SEMHA for some of these jobs? Is that
That has not been said explicitly, but I would imagine that is definitely the case. One of the things that did come up was that SEMHA, in using SEMHA, these local municipalities have flexibility, flexibility in hiring or providing manpower for services and that kind of thing. So, yeah, I suppose that there is a significant reduction in cost factor.
So,
and if it's through the chair, if I can add.
please,
Kamal Keperu,
name and title again one more time, sir.
Kamal Keperu, Finance Director for Health Veterans and Health Veterans Services. You said it, Chair, but the other part is when the grant disappear, or if we lose the grant or the grant expire, it's easier to, let the employees go, for lack of a better term. Because if it's done, other way, it's just a little difficult once they become county employees.
And thank you, Mr. Keperu. I was going to get to that too, because on some of these items, one year we get funded by the state, maybe the next year we don't.
Correct.
And then so to jerk employees around and have to let somebody go because the grant's gone and hire somebody else in a different. So SEMHA helps smooth that process out.
Correct. And in addition, of course, this year, everybody knows it's unique with COVID. We're getting a lot of grants. That's up to December, Carol, or March?
Yes, many,
Yeah.
and December 30th.
Yeah, so we're getting a few short-term grants that, of course, we need the staff and support. But again, these grants, some of the grants end in December. And I thought I saw a few that maybe end in March, but nevertheless, they have a quick turnaround period.
Yep. And there might be a few more coming, depending on what Congress does. All right, thank you, everybody, for that information. Commissioners, let's go to questions on item, I believe it's 18, SEMHA. Commissioner Marecki, do you have questions on this item, please?
No questions. Thank you.
Thank you. Commissioner Dobb, questions?
No questions for me either. Thank you.
Thank you, Commissioner. Commissioner Anderson?
I'm all set. Thank you.
Okay. And Vice Chair Baker McCormick?
Yes, just one clarifying question with the, Carol, you started talking about the lead base paint, or not base paint, but the lead poison procedure, what they do exactly. But did you complete? I don't think you completed that process. So can you tell me more about that? Because I actually have a lead testing resolution that's being worked on. So I just want to completely understand what they're doing around that.
Sure. To go into a home and actually conduct a lead inspection and assessment for the lead-based paint, and an individual must be certified by the state of Michigan as what was called a lead risk assessor and inspector. So these staff then, when the homes are identified, they go in, they do that full assessment of where the lead-based paint
Okay,
hazards
and
are. That's
before
what-
you go on, how are can someone call and say, I think my house has lead in it, or do they have to, is it a referral process? How does
Right,
that
it's
work?
good question, and we get referrals multiple different ways. Like you say, it can be someone coming in just, I have a house that was built before 1978, and I think I have lead-based paint. Most of the times, the referral does start with the fact that we have that full-time public health nurse case manager who her full-time job is to review all of the blood lead results every week from the state of Michigan. She contacts the family, then that's where they start with that analysis. I will tell you, most of our referrals start that way with a child that is, lead poison, but that's not a requirement, is what I'm saying.
Okay, and you're saying that there's only one person throughout Wayne County or one nurse that deals with the?
Well, yeah, but like I say, that she is full-time, exclusively for that. And so because there's enough work for her, I will say many counties, their public health, they don't have like a full-time public health nurse where that is, the full-time job as far as, she does that nursing piece.
Okay, and so then she is not doing the testing, but she actually follow up on reported cases, or?
Right. And then, it is then the key is to find out where is the source of lead for why that child is poisoned. And as we've said many times, it is lead-based paint. Many times it's because of, the windows going up and down, the door jams, where that lead-based paint is, and then the dust.
Okay, and so she goes into the home and interviews the homeowner or renter, and because it was reported to her from another state agency that this child had high levels of lead in their system.
Mm-hmm. Exactly. And, that home visit is really very, it's very important and very, can be very revealing. Sometimes, geez, we don't know. And, things will be when they're actually in the home with the parents, with the child, then they have that, are able to figure out, what is the source of the lead, and, why this child has been poisoned.
Okay, so if the child is also poisoned, then wouldn't it be a fact, I guess, that the parents are most likely also being affected, or all of the family members?
Right. Certainly they could be. Lead poisoning has its most impact on children that between birth and 6 years of age. That's when the developmental process is happening. Those are the critical, residents, the children between the ages of 0 and 6, when they are, developing, and that's when we want to, identify any who are lead poison, and then where is the source of that lead. But you are correct. Other members of the household. Yep.
Okay. And are we doing anything to, once that home is identified, are we doing anything to help the whole, the entire household, or just the children involved? What's the next steps once it is identified?
Yep. The next steps then to get that lead-based paint abated through, depending on what they identified. Many times, as I've said, it's, replacement of the windows, replacement of doors. It can be, painting. But, we talked about even where, replacement like of the porch a lot of times. And then certainly if that family needs other services, that's what, with Health, Human, and Veteran Services, we can then identify if there are other services that they need, or maybe even, here, Joan Sirakos was on, if they even have a family member, maybe who doesn't live in that home, but somewhere else and is a senior and needs, Meals on Wheels. That's been, really the beauty of our whole department coming together years ago when, so we've got services for many different, needs in a family. You're exactly correct.
Okay, and is there a cost to the family for this?
No.
Okay. So if the family needs new windows, whether they are a homeowner or renter, we will assist with that.
Right. They do have to meet the low income guidelines. I will say that. But as you're saying with the renter, the homeowner in that scenario, the homeowner does not have to be the low income. The renter, though, is low income.
Okay, so if the renter is low income living in a rental property, we will actually go in and assist the landlord with the cost to replace windows.
That is correct.
But we wouldn't necessarily, if their income was above, say this was a homeowner, if their income was above a certain level, we would not help.
Right, there we could not.
Okay. Okay, thank you.
Thank you.
Thank you, Mr. Chair. Commissioner Killeen. Uh-oh.
Yeah, I muted
here?
myself. What's up?
Okay.
I probably sound a lot better when my lips are moving and no sound is coming out. But so what's the pleasure of the committee? And a motion here would have to include
Chairman.
A provision that, as we discussed earlier, that the right piece of paperwork show up at full board.
Chairman,
Yes.
before, this is Felicia.
Oh, yeah. I was about to respond to your text. Commission counsel, please.
So through the chair, it doesn't appear that Commission Counsel's analysis for this item is in the packet. So I just wanted to note the concern that we noted in our analysis for commissioners. So this particular agreement has, I believe, 5 exhibits. 2 of those exhibits are listed in the table of contents, but they're not actually listed in the document. The table of contents is, informational. It's not an effective portion of the agreement. Our opinion is that that means that these exhibits are not actually incorporated. Corporation Counsel offered a different response. They believe that they are incorporated accordingly and that they are binding on the party, even though they're not, those particular 2 are not actually in the body of the document. So I just wanted to note that. Again, I also note that, Corporation Counsel offered a different opinion. I think some of it was based upon the fact that there were other disclosures and communications with the vendor, so they feel comfortable moving forward in the current form. But I wanted to note that because it's unusual to have items just listed in the table of contents and then say that they're binding on a party. So that was our analysis. Wanted to note it because it was not in your package. Thank you.
Thank you, counsel. And counsel, is that a fatal flaw?
Again, my opinion would be I would have great concern if some type of dispute rose with regards to the content of those, whether or not they would be binding. And so we would definitely recommend it being changed. Again, Corporation Counsel offered a different perspective, perhaps based on some other interactions they've had with that vendor. But from our opinion, yes, we always would recommend that you include your exhibits inside the body of the document and not in the table of contents, because again, the table of contents is not an effective portion of the agreement, and it's not something that's even required, and most contracts don't even have a table of contents.
I gotcha. So you're alerting us to a possible problem down the road.
Yes, but again, I will note that Corporation Counsel disagrees and they were comfortable moving forward with it, and that's why it made it for agenda.
Well, I'm hoping that somebody from Corporation Counsel is on this Zoom.
Yes.
Has-
Good afternoon. This is TR Winter from Corporation Counsel.
Mr. Winter, you've heard what Commission Counsel has to say. Please give us your take on this.
Yes, we examined and researched this issue. This contract mainly involves grant funds through the state and the federal government, and we researched the procurement law about such situations, and the case law that we found about it indicates that, especially because of the clause we put in the contract saying that everything from the procurement is included by reference into the agreement, that the particular case law involved attachments that were not even in the table of contents, and they are included as part of the procurement package and then part of the contract.
How does that language include that?
Because the relevant document being referenced both in the table of contents as well as being included in the entire package given to them for their review and signature, and also uploaded into the system as the entire packet that you review for approval, that the entire packet is considered the contract, not just that it does not need a specific reference to each attachment if it is indeed part of the complete package that is generated for the review and signature of all the parties, as well as the legislative and executive process for the contract.
All righty. Thank you, sir. I'm going to go back to Commission Counsel. Corporation Counsel has said they looked at this. Sounds like they were aware of the issue, and they looked at case law on this, and they added language to the contract to make it all encompassing with the services provided. Commission Counsel Johnson,
Yeah, so
what do you
Corporation
think?
Counsel, in their response, they did provide some case law information. We looked at it. Don't think it's on point or that it addresses the issue at hand. With regards to the language, that language was something that's in the standard contract. It wasn't something that was specifically added for this purpose. Again, 5 exhibits, 3 are included appropriately, 2 are not. It appears to be something that could have just been simply missed. But one thing I will note that is of concern, and that will come up with another contract in a future date, is this notion that just because something is included in a procurement package, if it's not included in the contract that the commission approves for the administration to take the position that somehow is binding, I think has very concerning broad implications. Because what you procure and what you put out to bid and what you actually get approved in a physical document from the commission, I would argue are 2 different things, because they have taken a position that those procurement documents and what's in the procurement documents essentially overrides what you approve. Don't agree with that at all. So I have some strong disagreements with regards to Corp Counsel, but with regards to this, it just appears that they missed it. In every agreement we get, the exhibits are listed in the document, and they're included in the document, not merely in a table of contents. But again, based on their research, they think it's okay. And so I'll just leave it there, but it's highly unusual, and my office simply doesn't agree even after we review the case law that was provided.
So counsel, this notion that because it was in the bid package, it can be included, the legal notion on that. How are we ever to prove what is really in the bid packet and what is not?
Well, what's in the bid package generally includes, for example, our bid packages include a template contract, but that template contract is generally negotiated after the fact. So if they put something in the bid package, some information, but that information does not make the contract document itself, what they're arguing is that the bid package overrides your contract authority and that approval.
Right.
I disagree with that. And again, this is the first time it's come up. I'm not sure, and there's some WIC contracts I think that they specifically apply to that'll probably be on your next meeting agenda. But I don't even understand the concept, though we did look at the long response that Corporation Counsel provided and the law that they provided, and it just doesn't appear to be on point, or not. I don't agree that it says what they say it says. So we just have a basic disagreement with regards to that issue.
Well, specifically in this case, Counselor, how does the commission know it was in the bid package?
We don't necessarily know that because staff doesn't necessarily, we don't review the bid packages, and they're not always included with the document. So when we get a contract document, we get a lot of information that's not a part of the contract. We'll get emails from the administration, we get cover letters, we get all type of forms and documents that's not a part of what we're actually approving. So even the notion that just because it was uploaded in TCM means that somehow it's included in the contract package is just not correct. Because again, we get emails and a bunch of other stuff that's not legally binding and part of the contract. So again, I just don't understand or agree with the comments, and that's all I can say. We just have a general disagreement, but they're comfortable moving forward with the department in this manner, and it's, you know, their responsibility to defend it if something happens, but we hope that this, you know, nothing happens because we've worked with Semha for years in the past, so.
Well, I appreciate that input, Council.
Mr. Chair?
Because I do think you're right. Yeah, Commissioner Baker McCormick?
Yes, and I believe she's correct as well. However, is there a way that we can look at changing or making a correction?
That was my next question to Mr. Winter. Mr. Winter? This doesn't seem to be insurmountable to include that. What do you think at this point, Mr. Winter?
Yes, I think if we move it forward for the commission with the proviso that it be directly linked, we certainly are willing to do that. It can be done quickly and approved by Semha, I believe. Yes, that's not a difficulty on that.
Well, I would opine, Mr. Winter, that that's the appropriate way to move forward at this point. And we'll let dueling councils work out the larger issue for future contracts so that we approach this the same in all the contracts. But Corporation Council, you're telling us today that for purposes of Thursday's full board meeting, you can make those changes that is suggested by Commission Council?
Yes, we can add the direct reference to those two attachments into the contract. Yes, I believe.
Okay, let's make sure all councils talk to each other, you know. Commissioner Baker McCormick, I'm sorry I stepped in there. You really still have the floor. Commissioner Baker McCormick, would you still like to have comments here? Commissioner Baker McCormick.
I'm sorry. No, I'm
It's all right.
Thank you.
You're all okay. You're okay. So, pleasure of the committee. We have heard from both councils, and Corporation Council has suggested that we move this forward, that they can handle the paperwork to correct this situation by Thursday. So what is the pleasure of the committee at this point?
Mr. Chair.
Commissioner Anderson.
Yes, I think this has to be done by tomorrow, doesn't it? Because we're approving the budget. Isn't this what we were rushing to get this done for? So it'd be in time, because we'll vote on the final budget tomorrow, my understanding. Special meeting tomorrow to approve the budget.
Yes, that is correct. And maybe we can have Commission Council answer that question, because then everything we do today would be on tomorrow's agenda. Commission Council, if these are not approved until like noon on October 1st, at the board meeting on October 1st, does that present any legal problems, that these contracts then would not be at the beginning of the fiscal year for their start?
I would have to defer to the department for them to advise if they see any particular concerns. And I'm also not sure, and we'll defer to our clerk's office to determine if these were slated for Wednesday's full board or Thursdays. I thought that some items could potentially be going to Thursday and not Wednesday. So I'll defer to both of them to respond to your.
Okay, let's start with commission staff then on this. Commission
So
staff.
that is, this is Pamela through the chair. They were slated for Thursday's full board meeting. That was the plan. But if there's a budgetary issue, I guess that can be discussed. But the plan was to send these to Thursday's full board agenda.
All right, then I guess, and I don't know, Mr. Winter, if you can speak for Corporation Counsel on this. Because the terms of these contracts are October 1 through September 30, most of the contracts that we have for the fiscal year. If they are approved by the county commission on October 1st of the year that they start, Corporation Counsel, is that going to present any legal snarls?
I can only speak to the SEMHA contract. I believe getting it approved on the start date is appropriate, that we maintain their services and there won't be any breaks in coverage for them.
And I imagine that would be a principle that would apply across the board. I understand you're here to work at this one contract, but I don't see any legal difference between this contract or any other contract being approved on the 1st.
I can't think of any offhand.
Okay. I think it was Commissioner Anderson that started this line of questioning.
Yes, I mean, I just, I thought that was one of the reasons we were trying to wrap this up to get it in the new budget year. And that's, my understanding is the budget is going to be approved tomorrow. That's why we're having a special meeting. But
The real reason was to get this done for the start of the fiscal year.
Right.
Is why we moved it here. I don't think, yeah, these dollars are in the budget, but we also have to execute the contract for it. So
Okay, I'll leave it to you, Mr. Chair.
okay, yeah, we weren't doing this for the purposes of the budget. We were doing this for the purposes of the start of the fiscal year. So, okay, given that, the pleasure of the committee. On the SEMHA contract.
I would move approval of the contract with the proviso that the change of our legal counsel had brought up.
And I'll support Bob.
Oh, all right. Dob came in first. I know there's a big contest on that. So we have a proper motion and support. Are there any other additional questions at this point before we go to a vote?
Through the chair, Commissioner.
Yes, Ms. Carr.
SEMHA also has to, is contingent upon getting the funding number corrected.
That is correct. Is that part of your motion, Commissioner Anderson?
Yes.
Okay.
I'll make that.
Yep. And Commissioner Dobb is the second. It's part of the motion?
Yes.
All right. So now we have a proper motion on the floor before us. Any other questions on this item from commissioners? All in favor of the motion before us, please say aye.
Aye.
Aye. All opposed to the motion before us, please say nay. And are there any abstentions? Okay. Thank you. Commission Clerk, what's next?
E, such other matters as may be properly submitted before the committee.
I will just comment before the committee, we're stacking up some reports to come to this committee. Not next week, but the week after that. And if Ms. if our health officer is still on the line. So it'd be like 3 weeks from today to kind of get another COVID update from our health department. I'm shooting for, again, not next week's meeting, but the one after that. So that's like 3 weeks away. 5 weeks away, we're heading towards having the solid waste folks in the county come before us to talk about solid waste in the county. We are the largest cubic, hopefully it's meters of landfills of any county in the state, and some rules are changing in Lansing. So we want to get all caught up on trash. And then I think the meeting after that, and it came up today, that we can go to the juvenile court and the chief judge over there, Judge Joseph, come and discuss with us from the court's point of view these juvenile justice programs that we've been discussing, and that'll be out for RFP for next year. So I just want to make commissioners aware that that's, for now, that's kind of the schedule that we have for presentations to the committee. Anybody else have any matters for the committee? Hearing none, next is public comment. Ms. Lane, do we have any email comments that have come in? Since they sent them to you? Do you know, Mr. Rainwater? Do we have any email comments that have come in?
As far as I understand, no.
We don't have
none.
any email comments.
Okay. Does any member of the public attending this meeting wish to address the Health and Human Services Committee under public comments? If you do, you will have 2 minutes to make a statement. It's public comment, so we do not have a back and forth discussion. If your statement to the committee needs follow-up, then we will get that after the meeting. Is there anybody on the phones indicating that they would like to have public comment? Is there anybody on the phones that would like to have public comment? I'll ask one more time. This is the time for public comment. If you are Zooming in with us today and a member of the public, do you have a comment for the committee? Hearing none, Madam Clerk, what's next?
Adjournment.
Committee?
Move to adjourn.
Support.
Moved and supported, Dobbin Marecki, and the chair rules that without objection, we stand adjourned. Thank you, everyone.
Thank you.